All right, we'll call the meeting of the Board of Supervisors to order. Just like to make the comment that we are experimenting with some new technology today. We're going to kind of see how things work out in this. There's definitely going to be some bugs, and hopefully this helps with some transparency to the public, number one, and the ability for people to go back and check something out on our meetings, as these will be uploaded to YouTube immediately following the Zoom meeting, I believe is how it's going to work. So bear with us on some of this. We'll get the bugs worked out on it, but I think it'll be better for the public as a whole doing it this way. So first item is approval of the agenda.
Motion approved.
Second.
Those in favor?
Aye.
Opposed? Minutes of December 15th, 2020 board meeting.
So moved.
Second.
Those in favor?
Aye.
Aye.
Opposed? Number 3, final reading of the floodplain management ordinance, chapter 36. This is the third and final reading.
I would make a motion to approve the third and final reading and finally adopt and approve the floodplain management ordinance, chapter 36.
Second.
Any further discussion or comments? All those in favor?
Aye.
Opposed? Appointment of Beth Doggett to Conservation Board.
Motion approved.
Second.
Any discussion? Those in favor?
Aye.
Opposed? Number 5, Test Iowa update and discussion, possible decision on second testing period. Tim, if I could get you to come stand up here, so that way you're in range of the camera and maybe the microphone will pick you up.
Hopefully. Okay. First off, I give you some statistics that I think you'll find interesting, especially based on our original discussion. First graphic on the top is the bar chart that is included in your weekly report as well, but just kind of showing you the trends on the testing numbers. We did see a pretty significant surge for the whole month of November. We're down ticking a little bit in December. And it's really hard to predict what the human behavior is going to be through the holidays and how that might affect virus spread and what that will affect for demand. We did have a conversation in Healthcare Coalition this past Wednesday about how things are going with testing through all of our clinics, and things are going pretty well. They are still full. Our clinic is still full, so that shows there's still a significant need. And if you look at the positivity rates, the positivity rate for the Test Iowa Clinic itself is just over 20%. I think as a community, we're still averaging around 16. So that shows you there's still some significant activity out there.
Now, positivity rate is the number of positive cases compared to the number that you test. Is that correct?
That's correct. Okay. That is correct. And a good point you bring up, because a lot of people do that wrong. They think you divide that by the population. That's not how it's done. It's based on number of tests administered. The graphic below is answers a bit of the question that Jerry brought up initially about, we have a lot of folks traveling to the community to work from other counties, and this really kind of gives you an idea about that traffic movement. You get a lot of folks from Mahaska and a lot of folks from Jefferson County, and you'll see quite a few even beyond that. There is a bit of clinic shopping, as I call it, so people that need a test will travel quite a distance to get a test, especially if they have travel plans or they need a test to meet whatever airline requirement. So I've gotten quite a few of those calls actually. So kind of interesting information. On the financial side of things, updated spreadsheet here. Some positive news that you probably don't get very often. Compare that to the original projections they gave you on the cost of the clinic. What I did with this new spreadsheet was show you in a bit of color where the money's coming from. So we're pulling from different funds. One of the things built into the agreement with the governor's office, and we signed on to do this Test Iowa Clinic with them, was the ability to bill them back for to reimburse some of the costs of administering the test. And we really had no idea what that was going to look like initially, because we had no idea what the traffic was going to be. But they reimburse us $25 per test. for those costs. And if you look at what we've billed so far and what I project to bill, it is going to pay for the contract labor. So that's very nice. In my estimates for the second 13-week period, I was a bit more conservative in projection. So I projected 225 a week, so that averages, in a 3-day test cycle, that's 75 per day. So that amount, if those projections hold to be true, that's $144,248. Originally.
Now, Tim, for my benefit, that 144,000 is the complete cost for doing it for another 13 weeks. Is that it?
Yes.
Okay.
Yes. There's two columns there. You'll see the column on the left represents our cost for this period we're just finishing up. And then the second column is that second 13 weeks. So basically the only cost we have second 13 weeks is labor, the rental, and the cleaning, because we've already paid up front over our materials thus far for equipment. So then the yellow highlighted represents what we will need to pull from CARES. The blue represents the items I've submitted and received from FEMA Public Assistance. And then the orange is the money that is pass-through money from you all to my agency on the CDBG, which that 4,200 represents about half of it, and that was the sanitization equipment that we're using in clinic cleaning. So originally we discussed needing $124,000 from the CARES fund, but these projections show that we're only going to spend $77,000 out of that CARES fund. So quite a bit better than what we originally anticipated. So where we are with the second 13 weeks is kind of the same place we were this time in the original discussion, is back to staffing. So our current contract nurses are not renewing their opportunity with their agency to do this. They want to go do something else. I get that. We have one response from one contract agency. We're still waiting on the second nurse. So hopefully we'll get a bite or a person to set that off to do in the next couple of weeks. That's really kind of where we're at with that.
What's the date of the second 13-week?
So this one goes through the first week in January. And then the end of the 13 weeks would be the first week in April. I've asked the facility that we're renting from if they would work with us and give us that week, since we didn't start until mid-October. If they don't, then I would recommend Lanell that we end testing the end of March. I don't want to pay for another month just for a week. That makes no sense. And there's probably plenty of work to do for those nurses since vaccines are rolling in.
I know as you pointed out, you can't guess human nature necessarily. And we see the testing going down some. I wonder how much of that testing before shortly after Thanksgiving was people going on trips or to get on an airplane or whatever it may be. And then the possibility, of course, coming after. But do you think with the rollout of the vaccine, do you think people will start? Do you think testing numbers are going to drop just because people look at it as there's a vaccine now, this is over? You understand what I'm saying? And
Yep.
I'm
And a fair point. I think that's a definite possibility. We looked at the numbers when it spiked. It was actually before Thanksgiving. Initially we thought the holidays would cause it, but I think what we found through the case investigation was really a big factor in that was parties, was football gatherings and parties and home gatherings. And oftentimes they're with family members, but still, you get a big family unit together, they all spread the virus amongst themselves, and then that has a trickle-down effect. I think we may see the same thing over Christmas and New Year's, which will maybe be the predominant. The vaccine, it's going to take a while before we have enough vaccine to start administering to the general public. There's several different phases that you hear them talk about. So phase 1 is divided into A, B, and C. They're going to hit the critical frontline healthcare workers that are doing direct patient care, doing the testing, that kind of thing. And that will take some time. So we received an initial push this week Originally, the numbers were supposed to get us 30% of that group, and it didn't quite get to 30%. So if you can see, it's gonna take 3 or 4 shipments to get those folks done. And remember, it's not just a one shot. They have to have a second shot within 3 to 4 weeks after that to get them fully vaccinated. From there, we go on to other people that are high risk, like EMS and law enforcement and folks like that. And then we do the ancillary healthcare, maybe that don't have as much exposure in the allied health fields. And then move on to the public. So I don't think we'll see enough vaccine come out for the general public for another couple months at least. And the thought, the original design of the 6-month period with the testing was to get us maybe to that point, to then maybe, I think your point, Brian, that the public will say, you know what, we have a solution here. Let's get the vaccine. We're still seeing interesting responses on who's willing to take the vaccine. There's a lot of education yet to do. And I think a lot of folks are just waiting to see what side effects will happen with the first group.
So do we need to decide today, we need an approval or not of going to the next 13 week?
I do for the expenses that you all are taking on, which is the rent and the cleaning. You've been paying those correctly.
I met with Matt Thompson from Indian Hills, and he really encouraged us to go ahead and do another 13 weeks because, you know, they were testing, but they have problems with theirs. And he said ours has been a really big help to them because they could send people there without delay.
I'm glad you brought that up. He called me, they had their contractor doing their testing had some staff illness and they weren't able to do their test. And they were able to just bring their code for their test Iowa site, our test Iowa site, and it worked flawlessly.
And that's a pretty big group of clients there.
Mhm.
But do you need a motion? Is that we're going to proceed? I'll make that motion.
Second.
Any further discussion? Anything else you need to add, Tim?
I want to thank you for making this so clear for us to understand. You know, we're looking at a lot of figures, a lot of dollars coming from different areas, and you've
We
made
hope.
it pretty clear.
We hoped, and then.
So
and
you got
thanks for
approval on
you-
this last
Yeah.
one.
Well, and thank you for that. And I will tell you, yesterday, I finally received the final approval on the CARES funding. Kelly can attest with me that it's been quite the process and the state did not make it easy. But we got there.
Well, you're to be commended on that and any help Kelly gave, and so thanks for everything.
Thank you.
All right, we have a motion to continue the testing site for another 13-week period. Did you second that, Wayne?
Mhm.
If there's no further discussion, those in favor?
Aye.
Opposed? Number 6, approval of design agreement for bridge number 51. Nope.
Not knowing where that is, I will say a motion to approve.
Second.
Those in favor?
Aye.
Opposed? Approval of design agreement for bridge 19.
Motion approved.
Second.
Those in favor?
Aye.
Opposed? Approval of construction plans for bridge 206 on 60th Avenue over Jordan Creek.
So moved.
Second.
Those in favor?
Aye.
Opposed? Personnel employment of Heather Schwarty for, what is it? Schwartz. For kitchen vacancy.
So moved.
It's a vacancy that they left employment to.
Moved and seconded. Those in favor?
Aye.
Opposed? Any other business to come before the board?
Can I just mention a couple things? I just want to thank a few people for some help with some projects lately. So all this Zoom technology that I've been installing here and all the city hall throughout the county, I've had great technical help from Paul, sits behind me, our county IT director, as well as Edward Wilson, the city IT director. It's helped me learn all some of those technical things and how to get everything connected. And also the building maintenance person, the auditor's office, Tommy LaRue, for helping me install this equipment in here today.
Very
Good.
Brave new world, isn't it?
Scary. Pretty soon you'll like be able to talk on phones that don't have any lines.
Lines or
like that.
anything, yeah.
Okay. That answers the question.
Well, if there's nothing else,
Mel is joining us.
oh, I think we should adjourn.
I didn't know she had any comments. Linnell, can you hear us? Oh,
Are you in outer space? Hello,
Morning.
you can tell she's in the building.
you're live on the
The
internet.
last names for that one. What now?
You're live.
Yeah, I know I'm live.
A lie.
Don't worry about that.
Well, we've approved the next 13 weeks of testing. And is there anything that you'd like to add? Tim kind of gave an overview of things. Is there anything as far as the vaccines or anything you'd like to comment on or?
Well, we're right in the middle of a clinic right now of administering vaccine. And we will have the doses that we were allocated this week gone by tomorrow. We will have more vaccine coming in next week. And so far, so good. Several public health staff were vaccinated yesterday and we are fine.
Good. No negative reactions of anyone out of
No,
Wapello?
we've not seen any severe reactions thus far.
Very good. Any other questions for Linnell or?
Nope.
Linnell, how many total doses did the county get in this first round?
Okay, this week we got 400 doses. 300 was sent to the hospital for their staff, and I kept 100. Next week, we were allocated 400 doses. I will keep 300 and send 100 to the hospital to finish your vaccination of their frontline workers.
And am I correct that the long-term care facilities are separate and they're administering those themselves?
That is correct. The long-term cares are hooked up with pharmacies and they will take care of their residents and staff. We do not need to do that. But we do need to take care of an assisted living locally that was not assigned to a pharmacy, and we will take care of them.
Very good. Chad, do you have anything else? How will like county employees, non-emergency, or I guess you could say the general public, how will they be notified that it's their time to get the vaccine?
We will continue to let the public know as we find out what the priority groups are. Right now, we are focusing on healthcare workers, long-term care, and residents and staff in assisted living, hospice, and home care.
Okay.
And they are trying to determine the next priority group.
Very good. Well, I don't think we have any further, Linnell. We'll let you get back to work. Appreciate everything you've done the last 9 or 10 months, and maybe
Okay.
there's some light at the end of the tunnel.
Thank you.
Thank you.
Okay.
It's a lot easier to work in, a lot more comfortable.
Painters.
So that was an asset, yeah, painters use it a lot. So that was an asset we were able to secure from the state.
Very good. Was there any other business come before the board? I'll entertain a motion to adjourn.
Second.
Those in favor?
Aye.
We are adjourned. Thank you.